Good morning, everybody. It's Friday the 14th of January. Mark Dawes here. I've just got a letter that's been forwarded to me by someone who's contacted their MP. That's Ben Spencer MP, Member of Parliament. And it's in relation to BILD Act Certification and the RRN Standards. And as many of you know, there's a lot of confusion that surrounds these issues. So he's gone straight to his MP and asked for clarification on this. And this is the letter that they've received. They've asked for their name to be redacted, which I've respected. But I'm just going to read the letter to you so you can see exactly what it says. And again, this is to Dr. Ben Spencer MP. It says, "Dear Ben, thank you for your correspondence of the 24th May on behalf of your constituent, name redacted, about the Restraint Reduction Network, brackets RRN, close brackets, standards and the BILD Association of Certified Training. I apologise for the delay in replying, which has been caused by an unprecedented volume of correspondence throughout the pandemic. I read your correspondence with care and I appreciate name redacted's concerns. The Mental Health Unit's Use of Force Act 2018 sets out requirements for staff and the appropriate use of force. It does not mandate the use of the Restraint Reduction Network, brackets RRN, close brackets, national training standards, or the BILD accreditation scheme. Although the statutory guidance references the RRN standards and the accreditation scheme, it does not mandate their use. The RRN standards have been developed to ensure all requirements of the Act are covered. Staff education and training are central to promoting and supporting calm, safe and respectful environments where the use of force is kept to an absolute minimum. By understanding trauma and the reasons for a patient's behaviour, it is possible to preempt, avoid or de-escalate distress or conflict. To support this, the NHS has been working with arm's-length bodies on a cross-sector improvements programme to reduce reliance on restrictive practices and to ensure consistent standards across the NHS. With regard to the NHS standard contract, the NHS introduced a requirement on commissioners and providers to agree a Service Development and Improvement Plan, brackets SDIP, close brackets, in 2020-21. This requires providers to engage a training services supplier to deliver training in restrictive practices and to start to roll out such training. While the contract requires the use of an SDIP, which is a Service Development and Improvement Plan, on training in the use of restraint, it is for commissioners and providers locally to agree the content of plans, including the timing of any milestones. I also note name redacted's concerns about certified training for staff, as the independent regulatory body for health and social care service in England, the CQC, is responsible for deciding its own regulatory inspection and assessment framework. Name redacted may wish to raise those concerns with the CQC directly, and if you've been following my blog post, you've seen the Freedom of Information request we've had from the CQC, so you can find it on our website. And if name redacted requires further information about the scheme, he may wish to contact the NHS England online at england.contact@nhs.net. And that is signed by Edward Arga MP. So there you have it. It's not a requirement. It's as simple as that, really. And as you can see, it's not a requirement, as it makes it absolutely clear here. It says it does not mandate their use. So that's a letter from one MP to another MP, which has been raised by someone I know who's forwarded this to me to share with you. Hope that makes sense, and I look forward to your comments. Speak to you soon.